Greetings. This is Rodrique Kikwaba presenting on behalf of Howard University on improving COVID-19 vaccination acceptability and uptake through the Differentiated Service Delivery Plus program in Zambia. This is the outline of our abstract. We'll talk about the introduction of Howard University DSD Plus. We'll talk about Howard University scope of work in Zambia. We'll talk about our demographics, the vaccination acceptability and uptake in Zambia as of September 2021. We'll talk about the methodology used for our abstract. We'll also talk about improving COVID-19 vaccination acceptability and uptake in Howard University DSD Plus clinics. We'll show you the result. We'll show you the vaccination trends in DSD Plus clinics, and we'll conclude and give recommendation, and we'll also show the authors of this abstract. Howard University has been working since 2017 in Mateo General Hospital, offering the DSD Plus clinic. The DSD Plus model is the DSD Plus is a DSD normal clinic plus other extra services. And our key features in DSD Plus clinic is about being client-centered and being flexible and having extended hours of operation. We are a multidisciplinary team that we approach the healthcare services. We are promoting a proactive appointment system. We are doing concordance where clients have a say on your next appointment review. We are also working on reducing waiting time of less than 1 hour at the facility. We are and the TPT dispensation, virtual check-in by provider to assess adherence, pharmacovigilance, self-management, and medication storage, and other value services like appointment reminders, giving integrated primary care services, and providing other essential medication within the DSD. Doing the appointment reminders, this is a way to improve retention in the DSD Plus clinic. Our scope of work, we are working in 30 high-volume sites in 3 provinces, namely Southern, Copper Belt, with a total cohort of 125,337. In Lusaka, we are in 14 facilities. In Southern Province, we are in 10 facilities, and Copper Belt, we are in 6 facilities, and we are offering direct service delivery as well as technical assistance. Our demographics, the TX card that we are serving is 125,337 in the 30 high volume facilities, and this represents 11% of the national TX card, with a proportion of 66% from females and 34% for males. And our age group where we have a lot of clients, 90% is between 25 to 59%. And in the provinces that we are serving, Lusaka, Southern, and Copper Belt, we are serving a TX score of 28%, 16%, 5% respectively of TX score of the province. For the situation that we had in September 2021 on acceptability and uptake of vaccine, COVID vaccine in Zambia, 209,672 infections were recorded, with 3,606 coronavirus-related deaths, which were reported in the country. Zambia launched on 14th April 2021 the vaccination, and 5 vaccines were approved by the Ministry of Health. The eligibility, the people eligible for the vaccine were 3.6 million, and Zambia was targeting 70% of the eligible citizens by the end of September 2021. Zambia administered 602,990 doses, with at least 331,049 people receiving 1 dose, and 291,941 people fully vaccinated. And this represents only 3% of eligible population and 1.6% of the country population. From the figures, we can see that the acceptability and uptake has been low despite the vaccination rollout in Zambia. This is attributed to myth and misconception, some religious beliefs, long waiting queues, and in some cases, clients are not just ready for vaccination. Following MOH call to increase vaccination for HIV positive clients, Howard University established point of vaccination within the DSD clinic to improve acceptability and uptake and actively track outcomes of vaccination. We used review which is cross-sectional that looked at cross-cutting issues affecting vaccination acceptability and uptake within the Howard University supported site in Lusaka. We worked with the Lusaka Province Health Office, supported facilities and other implementing partners to integrate COVID-19 vaccination in DSD Plus clinic. The collaboration assessed the availability of space within the DSD clinic. We looked at the availability of staff, both professional and lay, to conduct health education in the vaccination. We looked at the vaccination supply chain, as well as the data management mechanism for effective timely reporting. Vaccination were established in 14 sites in Lusaka. Within DSD, we had 7 and integrated vaccination point in 7 other sites. We used already vaccinated clients that we call expert clients to give health education to influence decision on vaccination. Acceptability of vaccine also improved by a one-on-one counseling to mitigate vaccine negative perception. Clients opting for vaccination are guided to the vaccination point after pharmacy, and the facilities using integrated point, clients are escorted to the vaccination point. However, for refusals, reasons are documented and sorted out, and this documentation is used during our routine follow-up by our community health workers. This is the project of advocacy for COVID-19 vaccination that was used in the DST Plus clinic. When clients are coming from home, they go in the DST waiting area. Health education is given to them by both professional, lay counselors, as well as expert clients who are vaccinated, and we are using them as role models. From the waiting area, the patient will go to the clinician, where they will have a one-on-one counseling to assess the vaccination status. And here we have 2 types of clients. We have clients already vaccinated who establish evidence. If evidence is present, they'll go to the pharmacy and get their medication and go home. For those that without evidence, we counsel on the importance of vaccinations, we provide education and reminder score. For those who are not vaccinated, we are going to establish reasons and offer vaccination. Vaccination not accepted, we'll continue with counseling on the importance of vaccination, provide education, reminder scores. For those who accept vaccination, they will go to the pharmacy and then being escorted to the vaccination point, and later on they will go home. The result of our abstract or our review that we had in Lusaka, we are saving 91,512 clients, which were enrolled in HU DSD Plus program. We had 14 sites where the review was done, and this is of September 2021. A total during that month of 16,657 clients were seen in DSD, cancelled and offered COVID-19 vaccine services, of which eligible clients were 13,717, and we managed to vaccinate 2,698, which is representing 20% of the total clients who were eligible for vaccination. And this was compared to the 3% that is national achievement. 2,940, we should note that we are already vaccinated, while 11,019 opted out. The cumulative number of clients in DSD Plus as of September who were vaccinated was 5,638, with 50% of the vaccinated clients were within DSD. This is the trend of the vaccination. You can see that in week 1 of August, we're at 15% healed in DSD Plus. And when we started in week 1 September with promoting the acceptability and the uptake of vaccine in DSD Plus, we went to 20%, finishing at 29% in week 5 of September. You can see that there is a very huge improvement, and this after review showed that the intervention which was put was really beneficial for the vaccination. In conclusion, a multifaceted approach is very key in improving acceptability and uptake of COVID-19 vaccination in the ART setting. And then we recommend integration of vaccination services in routine DST activities. We recommend targeted individual client and counseling on the benefit of vaccine and mitigation of negative perception. working as well with expert clients who are already vaccinated, will improve the outcome of vaccination, because this expert client will be used as role models to fellow clients. And these are the authors of this abstract. We have people from our regional office in South Africa, the Zambian office, and our Washington office. Thank you.